Well, it's wonderful to be here today. I know this is the last stretch of several days of so much wonderful information. So it's my privilege to talk to you a little bit about what's been happening in the school and specifically in health coaching. How many of you have heard of health coaching or wellness coaching? It's become quite popular, so I'm going to describe a little bit of what's been happening in that field and how we've decided to incorporate that officially in our degree program and go for accreditation of that program. So, the learning objectives today are to do just that, a little bit of the benefits and evidence for health and wellness coaching, a model and framework for certification and why that matters now with health coaching becoming so popular, and how you can enhance the effectiveness of your health and wellness coaching efforts. And I know the speaker that follows me will be elaborating on that and how health coaching can be an effective technique and approach in health ministry. So a little of my own history. Much of my life at Loma Linda University School of Public Health has really been as an instructor. And that is basically helping people change their behaviors, helping people who are supposed to then in turn help others change their behaviors using a self-directed modification approach, which I was taught in graduate school. My background is in social psychology, so I was fresh out of graduate school, came to Loma Linda, knew all of the research, knew the techniques that work, and was very anxious to use that. I had physician residents taking the program, all of our public health students, a lot of our allied health students. So I got a lot of practice doing that, sharing what those techniques were, primarily around cognitive behavior modification. Here's what I found, and it's fairly consistent with what many of you have found as you've done work in this area, is that they were taking this for a course, so they were a little motivated to do what I was asking them to do. But only 60% met their own goal by the end of the quarter, which is typically 10 to 12 weeks. And by 6 months, when I would do a random check of them, 20% were successful. Now, these were folks who had the knowledge, had the information, but still they were struggling with maintenance. So we know non-communicable diseases and the lifestyle basis for that is an issue. We have not figured that out in this country and in many other countries. So I'm not coming from a perspective of we've got it all figured out. We haven't. In fact, we knew that there was something missing. That although things could work in a laboratory setting or a confined setting, that once things got out into the real world, people were more likely to relapse than not. And in fact, the data on relapse among some of the other behaviors besides drug use, drug and alcohol use, are just as bad or worse in terms of relapse. So very discouraging. We knew there was a disconnect between some of the things we were doing and how do we get people to make lifestyle changes. The health coaching market has exploded in this country and a few other countries, and I'll share that data in a minute. And of course, once you attract dollars and you attract an industry, people get interested in that. This is something, is it going to work? But there's a market for this. So things have proliferated. There are a lot of health coaches out there, and that means a variety of different things. How do we know what's essential, what's really evidence-based, and things that may not be as helpful but may sound good? So this rapid rise, at least in this country, in the United States, has been primarily connected with worksite wellness. Not totally, but it's really connected to worksites where health insurance companies and risk management companies wanted to say, we want to keep people healthy because they will cost us less. There was a really strong economic motive for that, especially once the Affordable Care Act began many years ago. The research also shows that 60% of employees want health coaching, but 80% were never offered. So that's created a demand and an expectation. What we do know that knowledge, information, and education alone does not result in lasting change. So all of the programs that are out there really have not been successful in producing the changes we're interested in. This explosion in health and wellness coaching certificates, and they're called by any number of names. This says 23, it's probably more like 50 or 60 organizations. When a review was done of those organizations, only about 8 were considered credible. That is, it was based on science, it was based on techniques that we understand really do produce lasting change. If you do a Google search, and again, this only goes back to 2004, but really the term health coaching, now other terms are in the media as well, has really peaked within the last 5 years. And around the world, even though this is concentrated primarily in North America and Australia, you see some of the other countries that are searching for this as well. So this is rapidly becoming a worldwide phenomena as something that people are getting excited about. Maybe this is something that could make a difference in lasting change. So I'll share a little bit of the approach, and I know the next speaker will talk a little bit more about this. But the fundamental difference in this approach is, rather than being the expert and telling people what they must do to lose weight, to exercise successfully, to change their diet, certainly you can provide that information, but it's really a shift in putting the responsibility on the patient, the client, to identify that for themselves, because if they do not, we're prescribing things that they will never end up doing, or certainly never end up doing in a sustainable manner. So they call this a client or patient-centered approach, and we've heard that a lot, but this is with a special depth that many of us that know what should be done, that know what behaviors should be done, are often challenged with, because we have to, as Dr. Medina says, bite our tongues. We have to help the clients uncover their potential. The focus in this is really that you're mobilizing our God-given internal strengths and relying on external resources for lasting change. And we've had a couple of sessions in the afternoons on sort of an introduction to health coaching. And it's interesting with this approach, somebody mentioned, well, Christ really was the ultimate health coach, because he used motivational interviewing. He didn't just tell people what to do. He really walked them to bring out their motivations. Why were they doing what they were doing? He led them to the answer, if you will, through what we see in health coaching. So not only is he the great physician and the great educator, he may in fact be the best health coach, and he's always with us. Pardon me. So talking about certification, with the ramp up with a lot of these programs, with the proliferation of programs, becomes the professionalization of something, setting standards, what works, why does it work? So the National Board for Health and Wellness Coaching, it is now called, really has taken a lead in this area, looking at the evidence for what are the essential components of a health and wellness coaching program, what needs to be included, what are the standards for educating health and wellness coaches. And as you can see, this is a relatively recent phenomena. They have administered the exam over the last couple of years, and it involves not only an exam on the knowledge component, but it involves an experiential component. Health coaching is not something you just learn about, you must practice. It takes time, even for experienced health professionals. They need to be coached on how to coach, at least on how to do it effectively. But it is a model that can be translated at a variety of levels. So the part that we took at Loma Linda was really to say, we're here for educating health professionals. How can we add this to their toolkit? How can we add this to what they do to make what we already do even more effective? So the current guidelines, and they have been shifting because the health and wellness coaching certification has been in a transition period. It does require some education and experience, either work hours or others, but it doesn't specify the area. In other words, this certification is open to all who meet this criteria. But the essential thing is, do you have experience? Do you have experience in working with individuals? Because that's a critical part of this. A completion of an approved program, and then a written log of 50 health and wellness coaching sessions of at least 20 minutes each. Again, because they understand that to learn this effectively, you need to be coached through it. You need to understand what is the best way to ask questions and elicit the responses from your clients that will really help them move forward into lasting change. The program components are there. I won't go over them now. There's more detail about that on our website, but it is really trying to codify or standardize what are the essential elements. One of the things about this is they've done a job task analysis. So they've taken about 800 to 1,000 health coaches that are already been practicing. They identified what are the common things that they do that are essential, and then they built the certification on top of that. So as you can see, it's a fairly sophisticated process at this level for identifying who are those who can be coaches at this level, who can then in turn help others be coaches. So it talks about the relationship. You are standing beside your patients and your client. You are not just prescribing behaviors and prescribing things. You are really learning how to be a person that stands beside them to lead them to success. Evaluation of progress, the professional behaviors. When should you refer for additional counseling, let's say? 11 knowledge areas that they cover and 38 skill areas. So it's become a profession in its own right. And this is sort of the first step that takes us there. So I'll give you a little bit of the evidence for health and wellness coaching, because that probably is the biggest concern right now is, what is the evidence? There's been a mad rush for people to engage in this. Like, this may be the silver bullet. I don't think it's a silver bullet, but it's a weapon in our arsenal to help people become successful. There are very few randomized controlled trials on this, on what methods work best, so we need that evidence. Here's the problem with that, with health and wellness coaching, is that it really revolves around people making choices, whether or not they want online coaching, face-to-face coaching. And once you randomize people, you're starting to take away that choice, which is really so essential to this model. I'll give you a little bit of the evidence so far. This is in a worksite wellness setting where they had some traditional programs on weight loss, dietary change, exercise change, tobacco use, and stress, and give you a little idea that it appears to be an effective model for long-term change, but the jury is out on anything past 6 months to a year. So the program completion rates, and you'll notice one thing about this, that tobacco really continues to be a challenge, no matter if you're using coaching or not. Weight loss completion is also low. That's been another area that's been a challenge. But the other areas of exercise, stress, and diet were really above the 50% mark, which doesn't sound amazing, but if you compare it to other programs, that completion rate of a 6 or 8 week program is fairly good and better than traditional programs. The program outcomes is where it gets interesting. Now again, tobacco is the challenge. We see the typical drop-off from a 30-day follow-up to 180 days, where you have people relapsing and not sustaining their behavior. But here's what's interesting about the other behaviors, is in most instances, the gains seen immediately and within 30 days were sustained, particularly for exercise, stress, and diet, suggesting, and again, weight is an outcome, not a behavior, but suggesting that some of the other behaviors, this is more helpful than the traditional approach where you see a typical relapse curve. So there is at least some evidence that this approach is helpful in longer term behavior change, which is very encouraging. So what evidence is needed? We are all excited about this approach, but what evidence do we need? We don't know what aspects are most effective, and we don't know how this works in a faith-based setting. How do we combine that to show that this really can be something for lasting change? How does it compare to a traditional approach where coaching isn't used? Are all formats equally effective, face-to-face, online, telephonic? We don't have complete answers to that. And most importantly, from a public health perspective, is how do we scale that to a large population? And I think the answer lies in some of the other models. Not everybody can receive certification, but can we have models where lay people can be trained in this approach, much like community health workers? So that's very exciting, and I know you'll be hearing more about that. I'd like to introduce the team. I'm not the expert on health and wellness coaching. My team is, and I have a wonderful team here at Loma Linda University School of Public Health. Dr. Anna Nelson is the program director of our MPH in health education, and as you'll see, we added wellness coaching with the recognition that this is such an important skill set, we needed to add it. She'll be there this afternoon for our last coaching session here in the Gare room if you have questions to ask of her. And our expert wellness coaching team, they're all doctorally trained. They all received their degree in preventive care, and they really are the experts. They are the ones that have done this for many years and are the ones who they themselves are certified to be trainers in health and wellness coaching. So I really have to give a shout out to them. In fact, Dr. Medina, who you may recognize as helping with some of the stretch exercises throughout the week, is right now teaching a coaching class up in Nickel Hall in the School of Public Health. I'm going to give them a shout out because they may be streaming this live, but we have a shortened certificate program that they lead our students through. This is an example of that, the online component. There's certain components that need to be synchronous, some can be asynchronous. So you'll see our instructors on the right. This is another class, another view of that. Just a little bit about the MPH program and its accreditation. It looks like there's a lot of certifications here, but really our purpose with this is we wanted to rely on evidence-based to give people the opportunity to learn the skills in public health, in wellness coaching, in physical activity, and health education. So we take that very seriously and want to make sure that we're living up to the standards that those areas have set for professional practice. So that's a part of our MPH program that individuals will be able to sit for those certifications. So we're very excited to add wellness coaching to that package for no additional cost. Just to give you a little bit about the coaching elements or components, this is not the entire degree program. You can find more about that online. But the certificate program that's going on right now is there's a lifestyle diseases and risk reduction course that we teach in the spring, online and face-to-face. That's an essential component of certification that you need to understand some of the essential elements of health and wellness. And our wellness coaching labs, the first one of which is occurring right now up the hill. Again, if you're interested, we have our last session this afternoon, so if you get a chance, it's right over here in the Gare room, and I know our team would be happy to talk with you about this and share materials. I've provided resources and references. There's probably way more than you need to know about health and wellness coaching, but a lot of you who are interested in the evidence, I've provided references that you can go over. Thank you so much for your time today and for coming to Loma Linda. We're really honored to have you here. We're sorry that it's triple digit and it's a little hotter than you might have thought, but thank you for your time and attention today.